Hello, my name is Praxidi Silamaha. I'm a mother of three, a nurse by profession, and a double amputee. I lost both my legs below knee amputation in the year 2023 due to severe blood clots. I have been talking about my journey as an amputee since 2023 in my podcast, but I'm transitioning to videos because I have been getting a lot of questions from family and friends who want to know and see how I am doing. I had a new surgical procedure done, osseointegration, and today I'll be talking about osseointegration. Osseointegration is a surgical procedure, a titanium metal that's implanted into your bone. So after several months, it integrates with your bone and it starts feeling like your own bone. Eventually, when the prosthetic leg is fitted into the metal, it feels like your own leg. You know, the bone is integrated, so it starts feeling like your own leg. It took me roughly 5 to 6 weeks. People are different. I was lucky. I got fitted with my surgery at the beginning of April. I had my surgery at the end of February, and I got my final prosthetic legs towards the end of April. Yes, no, it's not painful. I'm able to stand on them. I do a lot of things. Of course, I walk with them. I am going to demonstrate so you can see and be the judge of it. You normally do get a wrench, but if you happen to lose it or misplace it, they always have them at Walmart or your hardware store. So it's always good to have an extra one just in case you misplace one. So the wrench, less than a second to take it off and to put it back on. Again, it doesn't take long. Just make sure it's tight enough so it doesn't detach when you're walking. Yes, I am. That's the beauty of osseointegration. You're able to feel whether you are on a hardwood floor, like for me, or if I'm standing on carpet when you're outside, you're able to tell whether you're walking on gravel, on a pavement, or on grass. When I put my foot on the pedal of the car, I'm able to feel it so I can easily drive. Yes, I do sometimes. It has no harm. You can sleep with them. But most of the time, I take them off at night when I'm sleeping. So if you decide you want to sleep with your osseointegration, it has no harm. I know that most of the times I come home, I'm tired, and I forget that I'm wearing my prosthesis. And I lay down on the couch and I go to sleep. You know, when I wake up, I'm like, oh my God, I do have my medals on. Because they're very comfortable. You sometimes don't even realize you're wearing prosthetics down there. So yeah, that's the beauty of it. Of course, yes, that is key. Most of the people don't go to osseointegration because they choose the osseointegration way because of infection. But when osseointegration, when I decided to go osseointegration route, I took it as any other surgery. Osseointegration is no different than any other surgery. Surgeries, whether big or small, the biggest risk factor is infection. And that's how I took osseointegration. So extra precaution, you know, just to make sure that you catch that infection before it gets worse. And I take extra minute when I'm taking a shower to go around my stoma, to clean it, to dry it, make sure there's no recipe for any infection. And of course, I inspect it. I check if there's any redness, if there's any pain, if I see anything, you know, like leakage that doesn't look right. And you can tell when something is abnormal. Be your own caregiver and then call the doctor, you know. There are so many medicines out there, antibiotics, that they can start you on if you happen to have an infection. And if it gets worse, of course, you go to the hospital. You make sure that you're seen right away. My osseointegration surgery was done at Hospital for Special Surgery. My doctor, Dr. Jason Horwath, a very experienced doctor, knows quite a lot about osseointegration, performed my surgery. When I went to Dr. Jason, he was my last hope. I had doors shut on me, and I was advised that I was not a candidate for osseointegration. But Dr. Jason took on my case and treated me as a person with a condition and not a condition. And for that reason, I will be forever grateful to Dr. Jason, because many of you know that I played basketball for my country. And when I lost my legs, I felt like I had nothing to go back to. Nobody even knew who I was or cared to even know what I've done in my past. So I just felt lost. And when Dr. Jason took up on my case and gave me this surgery last year, I felt like a part of me was restored. I felt like I'm getting myself back. And I'm a happy camper right now. I'm able to get up, walk, do whatever I want to do. So yes, Hospital for Special Surgery. My doctor is Dr. Jason Horwath. If you are out there and you are looking into getting osseointegration and you don't have a doctor, please call him for consultation. You will not regret it. You will not regret it, because I know I didn't. I'm living my happy moments right now. So again, don't forget to subscribe. If you have any questions, please don't hesitate to ask. If you do have medical questions, of course I can answer that. Call your doctor or ask your doctor, or if you don't have one, you can always use my doctor, Dr. Jason Horwath. Get a consultation with him. All right? You take care out there, be safe, and see you in my next video. Bye.